Good afternoon, and thank you for joining us for the Conversations on Food Justice seminar. We are just waiting for our attendees to join us, so we will be beginning shortly, but thank you again.
Good afternoon. I'm Corby Kummer, Executive Director of Food and Society at the Aspen Institute. And with our partners at Share Our Strength, you'll be meeting my working partner, Elliot Gaskins, at the end of today's conversation. I'm very excited to be presenting conversations on food justice, food insecurity, and mental health, the silent and devastating impacts on children and families. First, I'd like to say that we have closed captioning services available today via our YouTube live stream feed. You'll see the link posted in our chat. Spanish language translation is available throughout, provided by Community Language Cooperative, which advocates for community engagement by non-English speakers. Thank you to Viria Sosa and Priscilla Rice, who will provide live simultaneous interpretation and chat transcription throughout today's event. You can access these audio options by clicking Interpretation, the icon at the bottom of your screen, then pick your language preference. The final 15 minutes of today's conversation will feature audience Q&A. It's never too early to ask a question. Moderators are waiting live right now, and so as soon as the conversation begins, as questions occur to you, please put them into chat. You'll see where you can, and we'll be looking forward to a lively last 15 minutes of Q&A. So it's now my pleasure to introduce our session moderator and speakers. Our moderator and speaker, Dr. Cindy Leon, is an assistant professor of nutritional sciences at the University of Michigan School of Public Health, whose research focuses on food insecurity and the negative influence on health. She's especially interested in using this research to inform the development of federal programs and policies to help alleviate food insecurity and promote good health for vulnerable populations. Dr. Kofi D. Essel is a board-certified community pediatrician at Children's National Hospital in Washington, D.C. Dr. Essel also serves as assistant professor of pediatrics, director of the George Washington University School of Medicine's Community Urban Health Scholarly Concentration. He's a clinical public health mentor and the director of the Clinical Public Health Summit on Obesity. He's dedicated his career to advocacy and research around healthcare training, health disparities, and community engagement, with expertise and national recognition in addressing obesity and food insecurity in families. Susana Martinez is the Chief Strategy Officer and National Director of the Latin American Youth Center. She's responsible for the center's Promoter Pathway, an intensive case management model for disconnected and disengaged youth. She has expertise in providing clinical and case management services to immigrant families, victims of domestic violence, and youth and families within the child abuse and neglect system. I'm also going to go off script for one moment to say today is the last day of Tracy Anderson, who has made the Food and Society program run and made this very Conversation on Food Justice series the wonderfully fulfilling success it has been. My working partner, Elliot Gaskin, said we really should be renaming it the Tracy Anderson Conversation on Food Justice series. And so it will always be in our hearts. You heard her at the beginning, usually in run of show. It says voice of God. All of us feel that way about Tracy. So we salute her. We salute and welcome our wonderful moderator and guests for today's conversation on food justice. Thank you all for joining us. Cindy, over to you.
Thank you so much for that introduction, Corby. Thank you to Share Our Strength and the Aspen Institute for putting this panel together, not just today, but this entire series. I'm thrilled to be moderating this panel discussion today on such an important and timely topic. This is really a long overdue conversation on the impacts of food insecurity on children's psychological and mental well-being. And so today, I hope that we can touch on the perceptions, causes, and underlying mechanisms of food insecurity and children's mental health, as well as pivot the conversation to solutions. So just to give you a little bit more about my history, about 15 years ago, I began my service to this area by working at a local food bank in Oakland, California. I started off as a nutrition education intern and became their coordinator for their food distribution network. And I remember distinctly that one of my first days on the job, my executive director told me that the best day will come when we are all out of work. Presumably we would have solved food insecurity. And that clearly hasn't been the case because they have continued to serve just an unprecedented number of people, particularly during the last year. While I worked at the food bank, I had lots of conversations with food bank clients and anti-hunger advocates. I learned deeply about the experience of food insecurity in my community, and I decided that I wanted to work on higher level solutions to address the root causes of food insecurity and hunger. So I'm really honored to be here today to be moderating and part of this important conversation on food insecurity and mental health, the impact on children and their families. To provide a little bit more context, prior to the COVID-19 pandemic, approximately 1 in 7 families with children were experiencing food insecurity. After the pandemic started, early estimates are suggesting that as many as 1 in 2 families were now food insecure. We've long thought of food insecurity as a nutritional issue. And so our solution to food insecurity has been to distribute food or resources to purchase food. But there is this expansive literature now on these non-nutritional consequences for children in food insecure families. I'm going to give you a list. This is not exhaustive, but some of the outcomes that we know are related to food insecurity in children are increased developmental risk, lower psychosocial function, lower cognitive development, lower maternal attachment, hyperactivity, aggression and anxiety, internalizing and externalizing disorders, mood disorders, behavioral problems, inability to concentrate, difficulty getting along with peers, suspension from school, depression, thoughts of death, and suicidal attempts. It's hard to believe that one social condition could be related to so many adverse psychological, behavioral, and emotional consequences for children. So to help shed light on this issue, I'm going to turn it over to my esteemed panelists, Kofi and Susanna, to start the discussion. So Kofi, I'm going to ask you first. As a pediatrician, what are the effects of childhood food insecurity that you think doctors should be concerned about?
Thank you for inviting us today. Excuse me, I'm a little under the weather, so my voice is going to change a little bit, but would love to start with something that I often talk to my students about. And this is this concept of toxic stress, sort of an unrelenting stressor that individuals have difficulty coping with. The analogy I love to think about is something that used to terrify me as a child. And that's the image of a black mamba. The black mamba, as some of you may know, is the world's fastest land snake. It can rise up to 10 feet tall. When it strikes, it can strike 12 times in a row. It's very aggressive. It will chase after you. One bite can kill up to 25 adults. It's terrifying. If you were to walk outside your home and you were to see a black mamba, you may ask your family, let's go back inside the house. It's not safe out there. You may call animal control. They may come and they say, hey, we can't find the snake you're talking about. You may go outside your home again, you see it again, and you become more and more terrified. This unrelenting stressor is out there and you worry, when will it go away? Can somebody rescue me from it? Is it safe for my family to go outside? How do I get to the car? Will the snake get inside my home? All of us endure stressors, but when it's unrelenting, when we never get to sort of relax from that stress, it overwhelms the system. It literally rewires the brain and it becomes a toxic stress. Food insecurity is a toxic stress for our families. And we know, yes, food insecurity may wax and wane throughout the month, may get worse at the end of the month, may get worse in summertime, but it's a toxic stressor. And what it does to children in particular, their brains are very malleable. It permanently rewires their brain. You think about spaces like the amygdala and the hippocampus, the center of emotion, the center of fear and memory. When this happens to them, you wonder why, when a car may cross by an individual, they may go from 0 to 100 right away. You see PTSD-like behaviors, worsening anxiety, worsening worry, worsening depression, behavioral concerns. The list goes on and on and on. So instead of blaming our children, our families, we have to understand and approach this sort of through a trauma-informed approach, recognizing that there's long-term effects that permanently alter the brain of our children and our families.
I completely agree with that. And I really like that analogy of the black mamba. It really shows that this is a constant worry in a child's mind and something that children should not be having to fear, to be worried about, or to stress about. And it really highlights the critical period of childhood as being so susceptible to these external stressors. So Susanna, I know that you've done a lot of, you've witnessed a lot of children experiencing food insecurity and its related stressors in your work. Can you tell us about some of the experiences that you've had and how children's experience to food insecurity have impacted their mental health and their overall well-being?
Yes, and again, thank you to Share Our Strength and Aspen Institute for inviting us. I have been with the Latin American Youth Center for a little over 16 years, and it's a multi-service youth organization. So we encounter young people and their families in a number of different settings, in schools, at our community sites, and working with predominantly low-income families. Food insecurity is sometimes one of the needs that we try to address, either through our case management or with linkages to referrals. And it's something that often will take a little bit of time to expose. It's really interesting working with families in the ways that we have. The stigma around food insecurity often reveals itself in the fact that families will often not disclose that there is food insecurity in the home. And so really, as part of our relationship building, getting to know the family, getting to know the young person, we become aware of their needs. And at that point in time, try to make connections. A lot of times what will happen is, especially in the direct service, as we're meeting with our youth one-on-one or in an after-school activity, we always, I definitely want to echo what Kofi was sharing, but we always are very aware of how hunger will affect someone's mental health. And, even thinking in reference of always having some sort of quick snack or meal or something available, knowing that if a young person comes and presents themselves and they are in perhaps some sort of crisis or some sort of dealing with a difficult situation, we have now learned that one of our first methods of almost triaging is to say, let's grab something to eat. Let's make sure that you have something to help you, just, maybe, and without even asking if there even is any hunger or underlying food insecurity issues, just offering the food and giving that person a chance to perhaps take a breath, maybe, take part in a meal or a snack that might be the first one of the day, and then using that as a way to build the relationship and find out more about this young person's needs. But really what we see on our end, as I mentioned, is in the behavior, and really being able to notice that underlying that behavior, underlying that anxiety, that stress that might be impacting this young person is in many cases issues around food insecurity and hunger. And in most recent times, we have really began to realize that that is a critical aspect of case management and services that we need to provide. And we have been exploring different partnerships in efforts to expand that. As a community-based organization, we are not traditionally providers of food or other services in that area. But we started to and expanded our food and nutrition programs and really making that connection, like you said, to all aspects of youth development, knowing that it is very much intertwined.
You bring up that point about stigma, and I think it's so important to recognize there is huge stigma with acknowledging that your family is food insecure, and especially for children who might not want their peers or people outside their immediate family to know that they're going through this experience. So Susanna, how do you think we should be addressing the stigma around food insecurity so children can try to seek help if it's offered to them and they're not embarrassed about their situation in front of their peers?
Sure. We have really tried to work with our young people to help them experience and feel a sense of dignity around this issue. And I would say it's on both sides, both the young person and the parent. With our young people, what we've often found is that putting the food packages, whatever food that we might be providing, putting it into a backpack, putting it into a nondescript sort of packaging so that it's not so obvious that they're walking around with a package of food from the food bank. Things like that can go a long way into allowing a young person to feel comfortable asking for these things. And then also really taking time to educate and outreach to the parents and to the families that we serve. We have often had sometimes parents, when the young person has brought some food home, the parent contact us and reject it and be very upset that we offered food because there was a sense of shame that in some way this family wasn't able to provide what they needed to for their families, and really having to connect to that family and do the outreach and do the education around the fact that there really is no shame, that food insecurity is a very common problem, and that these are just resources that are available as needed, and slowly being able to kind of edge away at that stigma. But it is very challenging. It's something that is very challenging to deal with, especially with adolescents, especially with older teens. And like I said, we try to be as creative as possible, and also asking the families what could be best received by them. So for example, as part of our COVID-19 relief efforts, we found that traditional distribution sites where folks can just come and arrive and pick up a bag of food or a bag of produce and take it home, there were, especially in the Latino community, the immigrant community, not as many of those families and youth were showing up. And we were contacted by our area food banks and our partners to ask us and say, hey, can you help us with this outreach? We realize that this community is not coming out. At which point we said, you know what, there might be issues of access, there might be issues of language, and there might be issues of stigma. And so in order to alleviate that, we instituted a delivery system. So we actually began offering to deliver the food directly to their homes. In doing so, we saw a significant increase in number of families that began requesting food. Once the barriers were removed, both around access and stigma, we found that a lot of families were more willing to accept the help that they so greatly needed. So, you know, being creative, being able to really listen to the community to figure out what they need, what will help reduce that stigma, have been the few tools that we've tried to apply.
I really love that creative approach, and especially drawing on your stakeholders, the kids that you serve, and seeing what would be most beneficial to them. Kofi, I'd love to hear your thoughts on this issue as well, the stigma around food insecurity, the fact that maybe some kids or their families don't want to disclose it to a primary care provider, and how you can address it in your clinic.
Yeah, it's such a big deal. I mean, we see it in the research, we see it in our clinical spaces. When we first started doing screening sort of practices in our clinical setting, we saw something interesting. There was a lot of fear of disclosure. Now, when we first started, we started asking verbally about these screening questions, about asking around hunger questions in particular. And you saw a lot of hesitation. You dug a little bit more in the literature, you did a little bit more interviewing of the families, and you realized something. There was this fear of sharing their experiences because there was a fear of maybe you may think I'm neglectful towards my child. Doctor, if I tell you what's going on in my clinical space, what if you think I'm neglecting my child and not feeding my child on purpose, and therefore try to take my child away from me? Right? This was something that we had to realize on the front end, and really kind of create a better environment that created more dignity and safety for our families when we're asking these kind of questions. So what we sort of transitioned to doing was asking these questions, not verbally, but through sort of a sheet of paper or through a kiosk, so families can ask in sort of more neutral, answer in more neutral way. To kind of build off of what Susanna was saying, one of the things that I see, I guess, when I work with my patients, the kids in particular, I think the things that they feel more embarrassed about is being isolated in the classroom space. So if they're eating food and they're being pinpointed to say, okay, he's getting school breakfast or he's getting school lunch, am I being considered as poor or lesser than? And kids just want to be accepted, right? Want to feel a part of the team. And so a lot of kids will avoid eating. Like not eat during those times. It's going to worsen behavior, worsen anxiety, worsen stress. So a lot of the things that we've sort of been advocating and pushing forward, one of the things we do really well in DC is offer school breakfast across the board. Everyone, all schools, they get school breakfast, and the food is offered in the classroom, right? So it's not those kids over there, but we all get to enjoy this and thrive together. I think when you look at movements like healthy school meals for all kids, and the idea of allowing all children to be able to access healthy meals, I think it's something that we can't turn our back away from, because we realize that the majority of meals per day for a lot of kids are acquired in the school setting. So again, providing this environment allows them to really reduce the stigma. And last thing I'll say, there's something else I was thinking about as Susanna was talking, community eligibility provision, that idea of environments where you have a higher number of lower income schools or individuals. School lunch, school breakfast is offered for free, and we've seen that reduce stigma. So when you offer these things and allow kids to have access to them, we know it can reduce stigma, embarrassment, and really give children a chance to thrive.
Those are all excellent points. And I love that we're starting to talk about solutions. I think these are just so innovative, to think about backpack programs, to think about universal breakfast. All of these are really important and should be scaled up, so that it's not one community or one organization that is piloting these efforts. But I want to go back to a point that Kofi, you had mentioned earlier, which is that parents who might not want to verbally endorse some of the questions about food insecurity to a provider, food insecurity is not resulting from parental neglect. I think that's very clear through the research studies that parents are doing their best job to provide for their family, particularly during difficult economic circumstances, particularly in the last year with COVID. And as much as parents are trying to protect and shield their children from the negative consequences of food insecurity, maybe, sacrificing their own food so their kids always have enough to eat, children are extremely perceptive of what's happening. They are aware if their parents seem stressed because of their finances, because of they're waiting for their SNAP benefits to come in. They are deeply aware of the resources that their family has to purchase food, and they might even have some own strategies for helping out around the house that the parents don't know about. So I think that's that's kind of being a common thread through what Kofi and Susanna have been saying. But I just wanted to make sure that it's known that it's not a case of parental neglect or something that the parent has failed to do as their role as a caregiver and provider, that food insecurity is happening in their home. So before we get right into solutions, I wanted to talk a little bit about the COVID-19 pandemic. COVID has really just thrown everything into disarray. All the sort of like inequities that we've been seeing in health have been exacerbated. Food insecurity is no exception. But just thinking about this past year with education being disrupted too, and now children are learning at home, they're not getting school lunch or school breakfast as reliably, and they're potentially facing more food insecurity. How has COVID-19 exacerbated food insecurity and mental health for children and adolescents?
Who do you want to start?
I can start. So we witnessed a number of different things. One was at the very beginning of the pandemic, when we first went into lockdown across DC and Maryland, we tasked all of our youth developers and case managers with contacting every one of our young people that were in services at the time, which was over 2,000 families. And with the transition to virtual school, we anticipated that the biggest need, the biggest request was going to be around laptops or access to Wi-Fi, any of those things. No, it was food. Number one was food. And it was such a resounding need that we didn't necessarily anticipate for it to be so significant. But we realized very quickly that that was going to be an ongoing resource that we were going to have to provide for our young people. The pandemic, I think, really caused also a lot of families to have some interesting changes in roles. We saw a lot of young people having to step up and take care of younger siblings because their parents were ill. Their parents, might have been infected with COVID-19 and, were unable to properly care for or even go and try to access any of their benefits, any of the shopping that the parent would normally do. And so we found ourselves then having to help a lot of our young people walk through that process, for them to become educated and learn how they could go in and access EBT benefits, how we could make sure that they were identifying what foods that their family needed. If there were little ones in the home that we had to consider specific dietary restrictions to make sure that they got the food that they needed. And we saw so many young people, and I mean young people as young as 8, 10, really stepping up to the plate. And so I can only imagine the anxiety, the concern that brought on to young people to really have to take on that role of caregiver simply because their parents were physically unable to because of the illness. We saw that time and time again, as we know that the virus was disproportionately affecting communities of color. So being able to be accessible for our young people in that time when they had to take on that role was critical to be able to help do that. And then as parents were able to begin sort of resuming their regular activities, then at that point they were now more comfortable, more able to continue accessing the resources that we had helped put in place.
I wrote down a few things. So I think that it's interesting because when I first started looking at COVID and sort of its effects on populations, it looked like something that I would define as a great equalizer, right? Like everybody was sort of being affected by it. But the more we stared into it, we realized that it had this magnifier-like quality, right? So magnifying disparities that existed all along, and just really, especially around racial, ethnic disparities, socioeconomic disparities, we saw all these things being magnified. I think it's interesting when we look at the role of schools, because the pathways that fear, anxiety, mental health has worsened through COVID, there are many, right? So with schools offer this wonderful hidden curriculum, which is not really too hidden, of social emotional learning, right? Conflict resolution, all of these opportunities that are learned in the classroom setting, right? When you have families who experience food insecurity, we know oftentimes there are greater challenges of attention, right? Attention deficit disorders, trauma-inducing difficulty with attention, all these things are exacerbated. Now, you put a child behind the screen that's already having difficulty with attention. You have a family member, an adult, a caretaker who also may have experienced adverse childhood experiences and trauma in their own life. And you have this sort of perfect setup for just a lot of palpable stress in the home, right? And this is something that kids are now being isolated. They're on their phones more. There's sort of an increased baseline level of anxiety and stress, and it's just been worsened, right? And then, Susanna, you mentioned it too, like there's been loss in the homes. There's been loss in the communities. There's been loss in family members. We couldn't go and console. We couldn't go and be with grandmother. We couldn't go and be with our family members that were really struggling. And all of these things together, I think they're all very additive, and it's really affected the mental health of the children and the families as a whole.
Yeah, those are, I think it's so important to recognize just the unique situation that our young people have been put in this past year. Susanna, you brought up these really important points about stepping up to take care of their younger siblings if the providers in the home were ill. And Kofi, the points that you mentioned about children being deprived of the social emotional learning in classrooms and just having a higher baseline of anxiety and stress on top of everything else that they're already facing is so important. And certainly the policies that we have in place to address the economic impact of COVID have not been sufficient to address the implications for children, especially on their development and their health during this time. So if we talk more about solutions now, I love that you've both been touching on this the whole time. What other policies or programs should we be advocating for to make sure that children who are at risk for food insecurity can have the supports that they need to be food secure, but also to grow and thrive? Kofi?
I think the most important policy by far, I mean, we probably will go back to this, is thinking about SNAP and bolstering SNAP funding for our families. There was a recent report that came out from USDA showing that 90% of families, looking back maybe in the last month, were describing not having enough adequate funds to be able to purchase healthy foods for their family over the course of the month. If you look at households with children in particular, and look at the data across time, look at the course of the month. When you get your SNAP benefits at the beginning of the month, we see that by day 7, 60% of the benefits are spent. By day 14, 80% or more of the benefits are spent, leaving only 20% or less for those last 2 weeks. And you see these episodes, and yeah, you can argue, oh, well, these families need to learn how to spend their money better or spread out their money better. It's insufficient. Majority of counties around this country, SNAP benefits are insufficient. So that's the reality of the challenge here. So to get through those last 2 weeks, you see families doing all of these maladaptive behaviors, creating these really poor maladaptive associations and behaviors and relationships with food. So in particular, we've seen that during COVID, we've seen a lot of effects and benefits of increasing SNAP dollars to max and then increasing them up to 15% above max, recognizing that's more likely sufficient for families. And we did that with the last recession, right? 2009, 2007 and 2009. After that, we had sort of a recovery bill that encouraged increasing by 14, 15% SNAP. And you saw the improvement of economic outcomes. You saw the improvement of decreasing poverty and food security. We've made some positive changes that we're seeing now, and we have to keep making sure that we allow for sustainable, enforceable bolstering of our SNAP dollars so our families can be able to access adequate fruits and vegetables and great, healthy, nutritious foods to be able to live an active and healthy lifestyle.
Yeah, as someone who has researched the effects of SNAP, I agree with all those points. And some of the policy changes for SNAP during the pandemic have been long overdue, just allowing people to use their benefits to purchase groceries online, increasing the maximum benefit amount so people have more money that they can spend on food. It's not enough, and these are temporary. And I think we would love to see some of these policies be continued, be made permanent, so that families will always have enough to eat. And I also just want to point out that SNAP, it seems like a very controversial policy when you're on the Hill, but in actuality, it has tremendous bipartisan support that I've seen from my own research. Republicans, Democrats, even independents all support preserving this program and making sure that SNAP participants have enough to eat. So Susanna, if you want to add on to anything Kofi said, or what other policies or programs that you think, based on your experience, would be helpful for children during the pandemic?
Yes, so definitely echo everything that Kofi shared. I think the other interesting possibility would be to also be very cognizant of where there are essentially food deserts and challenges to accessibility of healthy food. Again, it was really interesting to see how many families were able to request and receive the food that they needed when we were able to deliver it. So, I think many of us during the pandemic relied on things like Instacart and grocery delivery services to be able to access food. I think finding a way for that to also be accessible, either with the use of EBT funds or other benefits that would also still allow for direct food delivery for those families that have challenges accessing food. I think something like that would be very beneficial, as well as I would say very much in the philanthropic world. As a community-based organization, we rely greatly on grants. Foundations support our efforts, and you would be surprised how many times grants do not allow us to charge things like food, which is surprising to me, especially when we try to really present the connection between food insecurity and a student's ability and ability to learn and to address issues like attention and whatnot. And yet there is also still this, I think, barrier that exists in understanding how much food is tied to these other issues. So I think those are other areas that could definitely be explored.
Going off that note, you both also mentioned earlier the stigma associated with food insecurity and maybe not wanting to seek help for food insecurity right away. And so how can we, in addition to this policies and programs that you both proposed, how can we try to break the stereotypes around food insecurity and break the stigma and try to promote help seeking, especially for mental health for food insecure families?
I can start. I think breaking that cycle or that stigma around mental health is, I mean, if you think even in healthcare, we're kind of new to this space. We've been rigid for years, and finally we're starting to use terms like burnout and compassion fatigue, and all these terms are what we've used to ride in finally having transparent discussions about our mental health. And I think in general, we have to normalize discussions on mental health around these topics, right? It's so important that we normalize them. Diversifying the workforce also helps as well. So we can have communication and families feel warm and accepted, even just having people in their communities that may look like them. I think that's a really powerful thing as well that we often see. And then I think the other thing too is the idea of mental health is so important. And recognizing that if you have a label of a disease or not, everyone deserves to have mental health, sort of this absolute wellness, no matter the state you're in. And that requires us to sort of open up the toolkit. It could be therapy for some individuals. It could be exercise. It could be prayer, sleep, whatever it may be. Recognize we have this wide toolkit, normalizing these things, and stop othering and blaming other individuals, recognizing the role of the larger system that plays a role on the behaviors of individuals and the feelings of individuals.
I think the only thing I would add to that as well, around, and to some degree it addresses the stigma, is related to mental health as well, is that there are definitely some cultural implications to stigma, and certain cultures that view both mental health and this concept of invasion of the privacy of the home as something that they really try to avoid. And so being able to really sort of address these issues in a way that normalizes it, that is not necessarily of any sort of invasive approach, but really showing the fact that this exists on all levels. I think Kofi just highlighted that, the fact that now we do hear concepts like burnout and compassion fatigue, and there's been this validation of the fact that mental health does not only afflict certain people, but that it can afflict anyone and everywhere. Similarly with food insecurity. And so I think being able to do that from the representation standpoint that Kofi mentioned, having people from the community. I know as a community-based organization, we usually rely on this sort of promotor model, which is a community engagement person, someone from the community, someone who speaks the language, someone who looks like, and maybe even from the communities that they're serving, to really help be that messenger. We believe that that really helps to be heard and to have this education received in a different way when those cultural aspects of representation are included.
Wonderful. Thank you both. I'm going to move to Q&A, and we just had some really fantastic questions come in from the audience. The first one that I'm going to ask is just probably the weightiest question that I've heard around food insecurity, one that I don't have a good answer for, but I would love to get a discussion from both of you on, is we know that addressing hunger is about more than just providing food. How do we begin to address some of the systemic inequities that contribute to hunger?
That is a big question. And it's absolutely true. There are so many broader systemic issues that really feed into this. We were, I mentioned briefly that this idea of food deserts. We're becoming very aware of certain sections in different cities, different areas where there are not even any grocery stores, mind you, any grocery stores that are constantly stocked with fresh produce and other healthy items. So really being able to examine why that is. I think that there, as much as food insecurity can definitely expand into different areas, the connection to poverty is irrefutable. And I think being able to look at the systemic changes that would be addressing things like poverty, and then as well as the layers on top that we mentioned, like stigma and access and all of that, are really what it would take. I wish I had a clear solution. I don't know, maybe Kofi has some ideas in his back pocket.
I can just add to what the great ideas you came up with. And I think that, at the end of the day, it's not, one brush stroke that can take away everything, right? Like we have to think about this through a multidisciplinary approach. One of the interesting approaches we use for another model designed by a researcher by the name of Dr. Shriki Kumanyika looks at sort of a health equity lens to approach the topic of obesity. But it's an interesting model that I think we can pull a lot from. And the 4 quadrants of this model, the first quadrant is building community capacity. So recognizing that individuals from the community need a seat at the table to be able to allow for change to occur at their own tables, right? So that's an important piece. And another one is improving social and economic resources. So we talked about increasing SNAP funding, livable wage, right? We need to think about the way that having resources in communities really advances the health of communities. In particular, some of our neighborhoods where I am, we have very few grocery stores for so many people versus other communities have far more grocery stores, right? So this is an issue of access. The other 2 things that Dr. Kumanyika talks about is the idea of reducing deterrence to healthy behaviors. So recognizing how predatory marketing towards certain communities that are really harping on certain Black and Brown communities in particular affects behaviors or wouldn't be done, right? And lastly, how do you improve healthy behavior or healthy options in communities, right? So improving access to these stores and these resources around as well. So I think sort of thinking about it through more of a comprehensive lens is so important. Even when I train clinicians to do this work, I always like them to think about, yeah, you screen, you intervene, you address in the clinical space, but you want to advocate, use your voice to step outside of those four walls of your clinic to speak against sort of the generations of systemic oppression and things that have caused and led to what we see today, right? And I think there's a lot of different ways that we talk about doing that. So anyway, I'll stop there, but I don't have the exact answer, but we got a lot of work to do for sure.
We absolutely do. And Kofi, I use that same article by Dr. Kumanika for my students when I teach about structural inequities and food insecurity. I think one of the first things that we can do is just acknowledge that food insecurity doesn't exist because people make bad choices or don't know how to budget their food. There are structural drivers to food insecurity in our communities. So things like poverty and racism and classism and unequal access of healthy food distribution or unhealthy food distributions. Where the McDonald's are placed in our neighborhoods are not by accident. The Whole Foods are not placed there, randomly. And so, addressing how we can make food more equitable is a good starting point. And also understanding the distinction between poverty and food insecurity is important too. Recognizing that food insecurity correlates with other insecurities like housing and education and health insurance. And so anything that addresses these other inequities around health and socioeconomic status will also have an influence on food insecurity indirectly. Kofi, I have a question for you from the audience. This question says, a Feeding America study recently found that more than 60% of parents trust their child's pediatrician to give them information. So how can we use providers to help end child hunger and improve health outcomes for them?
Great question. Perfect question. So we actually are working at the national and local level because we think it's so important. You have multiple visits with your clinician, your pediatrician between the age of 0 and 5, 18 to 20 visits, sometimes even more. This gives you a great opportunity to build relationship, rapport, and create the right environment and setting to be able to discuss some of these other social influencers of health, such as food insecurity. One of the things that when we started doing this work initially, we saw is that when I asked clinicians around the country, are you looking for hunger? Are you looking for food security? And they said, yeah, we do that. Well, how do you do that? Well, I look for weight change. I look for weight loss or weight gain. I look for signs of poverty. But all we're really saying when we say that is that we're using our own biases to be able to determine if a family is experiencing food insecurity. But the reality is food insecurity is often invisible, right? We cannot consistently rely on these physical exam findings, lab findings, other clinical exams to see, hey, this family is experiencing food insecurity. So it's so important that we use tools like screening tools. One of the tools we highly recommend is a tool called the Hunger Vital Sign. 2 simple questions you can ask in the clinical space that the family can be asked, and then we can figure out how to intervene. In order to do this work well, we cannot do it by ourselves. It needs to be a clinical community partnership. So working alongside our number of anti-hunger groups all around the country and other community partners doing good work as well, and figuring out ways we can better share data across the board and recognizing and humbling ourselves to recognize sort of that power differential and that we are all on the same page doing things, having our expertise in different areas. So sharing that responsibility is so, so critically important. And those are some of the ways we can do that. And when we intervene, I should say, I really like to harp on starting and anchoring with our federal nutrition programs, connecting our families to these programs. We know there's a huge drop off in WIC after 1. We know that a lot of families are not taking advantage of SNAP when they could be, and it can really bolster their income to their home. So making sure we take advantage of that and then connecting them to some of these other emergency resources as needed and as beneficial. So.
Yeah, I think SNAP is such a wonderful program that because of its flexibility really allows families to purchase the foods that are right for them to meet their cultural needs, their dietary preferences, and whatever else their family's food desires are for that month. And that kind of leads us into the next question. Susanna, I'm hoping that you could answer this one based on your work at LAYC. How does culturally relevant food fit into this conversation? How do we make sure families are getting food that meets not just their caloric needs, but their cultural needs?
That is so critical, and I'm so glad that someone asked that question. We, again, became aware very early on. A lot of times the shelf-stable food that we would acquire from the food bank or from different food pantries were usually, I would say, the more American foods, pasta and potatoes and things like that. And first we noticed it very much so with our Latino families, that they really weren't using those foods. A lot of times they would just go unneeded. And then the family would then just stop requesting the food because they felt that it was just not, it didn't match with their dietary needs. And we slowly realized, okay, wait a minute, we have to make sure that we are providing culturally appropriate food that will actually be used. Otherwise, this resource is really not helping them in any way. So making sure that we were adding things like rice and beans and masa and whatever other items that they would request. We also have seen a big growth in immigrants from the Middle East that are also now getting connected to the youth center. So being able to find halal meats for them and find out what other dietary needs that they have. And the minute we started providing a little bit more of that diverse food, again, we saw an increase in families willing to come forward and request assistance for food. So it absolutely is a key factor. And also, I would say we do make sure to provide some nutritional information as well, helping to provide recipes that maybe have more healthy alternatives. I know, at least for myself, I mean, I love Mexican food and not all of it is the healthiest. So, being able to provide our families with some healthy alternatives, different oils that you can use or different cuts of meat, things like that, being able to provide that nutritional education, but in the context of their comfort, their culturally comfortable food. It really helps open the door and help also, I think, in relation to that stigma.
Yeah, I love that how your response touches on some of the earlier points we raised as well, and helping to navigate around the stigma and encouraging people to seek help. It's wonderful that just providing a more vast array of culturally appropriate foods, you were able to achieve that. So this next question is about adolescents, and I think both of you could answer this one given your respective expertise. What would be the best approach for adolescents to recognize, acknowledge, and refer their peers that may be experiencing food insecurity to trusted resources?
In our clinical space, we ask the parents to step outside the room around the age of 12 and above, really trying to get the child ready for adulthood, right? In a few years, when they're 18, the parent will no longer be in that space. So we start asking them questions directly and just checking in on them, how they're doing, how's their mental health going. And we often ask the food insecurity questions to them by themselves. It's validated in younger people. It is a little awkward to ask. It's uncomfortable at times, but it is something that we're able to do then and there. And it's something that we can have sort of a transparent conversation about. And like you said, Cindy, teenagers, especially, teenagers oftentimes know what's going on in their home, and they often will try to compensate to really support their family members. So I think one of those opportunities that we get a chance to do is have that one-on-one moment to be able to speak about it in a more transparent way and sharing with them what are some of the other resources that are available, and also that their colleagues, friends can also be able to access as well. That is one of the ways we do it. We give them sort of handouts, materials, different things like that, that they can connect their friends and family to as well. So that's one way we try to do it.
Yes, I would agree. I think a lot of that, it comes in just setting the context. I think similar to something that Kofi mentioned earlier, making sure that any conversation around food insecurity is not presented in a way that could be seen as concerning that there might be any neglect in the home. I think a lot of times, again, young people might be resistant to disclosing certain information if they think it might reflect poorly on their parents or on their home environment. And so really putting it in the context where there's absolutely no question as to why the situation exists, just is, would it be helpful for you to take home an extra bag of food? Or is that something that, hey, we have some extra groceries over here in the food pantry. Would you like to take some? So really sort of making it as casual as possible. And again, that's actually the other trick. At all of our sites, we always have food that is available, some sort of ready-made bags of shelf-stable food, so that we can just offer it in that very sort of offhand way. Again, as low barrier as possible, no questions asked. Hey, do you want to take a bag of home food with you? And a lot of the youth sometimes will respond and say, oh, actually, yeah, that'd be great. And so then that later becomes a way for us to continue the conversation and address any more ongoing needs that there might be around food insecurity.
Yeah, I actually take a very similar approach on our college campus. And so college food insecurity is something that we haven't really touched upon in today's panel, but is such an emerging issue for young adults, particularly as they're trying to get a college degree. There's just been extremely disproportionate levels of food insecurity coming up on college campuses. And our response has been to open an on-campus food pantry. And there are a lot of students who don't want to acknowledge that they are food insecure, that they would need to go to a pantry to get food. And when I give my lectures on campus to different groups, I make it a point to stress to students, just go and check it out. It's a wonderful space to just hang out. You can meet other students there. There's a kitchen, so they do cooking demos. They do some nutrition classes there. And I try not to make it about, hey, you're going here because you might be food insecure and need a bag of food. And so trying to connect it in a way where friends can just say, let's just meet here. Let's just go check it out together. I think is really important, and it goes obviously beyond college age, and hopefully we trickle down to adolescents as well. So the last question I have is about the younger children. We've talked a lot about school meals and backpack programs, which some elementary schools have adopted. But what about children ages 0 to 5 who might be experiencing food insecurity? What are some strategies to help make sure that they and their families will have enough food?
The first thing, sorry to jump in, the first thing that I think about is, and I kind of mentioned it earlier, is the role of SNAP and WIC. So recognizing that your children can be placed on SNAP at that early age is so valuable. With WIC, right, women, infants, children, pregnant women are able to access quality food to be able to improve the health of the child in the womb, right? And we know that even the fetus is starting to sort of taste the flavors of the food right around 23, 24 weeks. So that they're getting exposed to that, the smells and all the foods. So I think it's really important to recognize the role of WIC. And when WIC drops off at the age of 1, we see a huge drop off. We try to get our families to sort of stick with WIC, recognizing there's roles that it can play. There's quality food that's providing that your family can really benefit from. So that's one of the things we try to harp on. And again, for us in the clinical space, screening early and often. So not waiting till the child is 5 or 10, but when they come to the clinic for the first time, create that relationship, showing that this is something we universally do for all of our children. We don't just do it for some, but we do it for all of our children universally. Screen and try to intervene. And I should highlight, there's a wonderful tool if anybody's looking for it called the AAP FRAC Toolkit that really shows you how to incorporate more screening and intervening practices in different settings. So it's a really wonderful tool.
Yes, I think I would echo all of that as well. Whenever we are dealing with, in many cases, it might be young parents themselves who have a young child under the age of 5. That's where we really do try and make the push to really make sure that they're enrolling in WIC or SNAP benefits, really educating them on the resources available. And we often do encounter a lot of these families in the context of parenting classes and giving parenting skills, and nutrition is a key component to that, being able to teach them what are healthy foods for little ones, when is it appropriate to start providing solid foods, and really actually that's also where we really encourage partnerships with their pediatricians, and really that's where we also encourage that sort of partnership. I think, as Kofi was mentioning, making sure that there is alignment around the medical care that they might be receiving, the preventative measures that can be recommended by a pediatrician, and then a community organization like us just helping to reinforce that and link them to the right resources.
Wonderful. I think it's really clear from just listening to both of you talk that it's going to take a village, and all of us have our respective roles to play in alleviating hunger and protecting the mental health of our children, particularly during this pandemic. So I want to thank you both for your time and your insightful and thoughtful conversation. I've learned so much by listening to your experiences. And next, I'm going to turn it over to Elliot Gaskins, who is the Managing Director of Development at Share Our Strength.
Thank you so much. First, I mean, just wow. Thank you, Cindy, Susanna, and Kofi for joining us today, but more importantly, for your amazing commitment to children and families. It is truly inspiring. If we've learned anything today, I hope it is that mental health and well-being is just as important as physical health. Both have immediate and long-term impacts. 15 months into the pandemic, children and teens are suffering from depression and anxiety at historic levels. This is a national crisis. A stark example of this is that for the first time in the 117-year history of Children's Hospital Colorado, they have declared a state of emergency for pediatric mental health. This is happening in places all over the country. Their chief medical officer said, and I quote, "We're seeing kids experiencing deterioration of their mental health at a time when we're exiting the trauma of the pandemic and re-entering into a more normal life. Our kids have run out of resilience. Their tank is empty. We have no time to waste in ensuring kids have the support they need." Be on the lookout in the coming days, and please share today's recording and our summary to action report that will be rich with resources and actions that you can take to help. And as we close, I'll finally say, as we finish our first season of the Food Justice series, I want to thank all of you. We will be taking a break during July and August, but we will be back with you after Labor Day. We will continue to work hard to bring you compelling content, extraordinary voices, and hopefully tools that you can use to impact your own community. Thanks so much for joining us, and we'll see you after Labor Day. Take care.